I'm Chris Peterson. Slight correction, Iowa Farmers Union. But president of Iowa Farmers Union and part of National Farmers Union, 250,000 family farmers and ranchers. And rural health care, what an issue. As I've said, it's beyond the mess. It's a disaster. The system is broken. And by that I mean the structure of the system, certainly not the care of the nurses or the doctors is broken. It's the structure of the system. People left behind, people not being able to afford it. And this is especially true in family farm agriculture and small town rural. It becomes an economic issue. Personally, I have two choices out there. It's don't have insurance, or go out and try and find high-cost individual private insurance. And over the years, our family, we went without health care insurance. We've had health care. And as you get older and you go in and out of individual plans, you have some health issues, and pretty soon you get so many riders on it and whatever else, you can't get insurance anymore unless you go through HIP Iowa, which I am doing, starting out at $500 a month. That's the cost of this stuff. And the wife, again, full-time job in town, but we don't have benefits. She doesn't have benefits. And what happens there is she has some health issues too, and in 1 year her rates went up 42%. And it's under $500 a month yet, but it's still some pretty trendy stuff. So do the math, that's where we're at with health insurance. And when you start comparing what it costs us to acquire health insurance and what the manufacturing plants and other citizens do their jobs, the type of health insurance and the coverage they can get, it's costing rural America and family farmers on average, I'd say 30 to 50% more per person to insure. And this is not the best insurance in the world. This is high deductible, high copay stuff. You know, whether it's $1,000 or $2,500 deductible, there's a lot of out-of-pocket expense. So you don't go to the doctor like you should, and that leads to one of the reasons why only 4% of the money in this country is spent on preventative health care. So this is a huge issue for rural America. It's a absolute, what do you want to call it, block in the road, because money has to be spent on health care while, you know, you still got to run the farm and other things. So all we ask in this is access and fairness, and we're far from it right now. Thank you.
Thank you so much, Chris. One point we'd like to make is that here in Iowa and across the country, farmers and small business owners alike are just being priced out of the system. The individual market isn't working, and we need to get out and reform this healthcare system. We urge all Iowans to get out on January 3rd and nominate a healthcare candidate to then become the next president of this country, and we can make some real reform and make some real change and fix what is just a moral imperative, just access to quality health care. Thank you so much.